Hi, my name is Brian Iuliano. I'm a neurosurgeon at Providence, Southwest Washington Neurosurgery, and I'd be happy to answer any questions you have today.
What do you like your patients to call you?
Dr. Iuliano is probably the preferable. My last name is sometimes difficult to pronounce. Dr. I is okay too.
Where did you go to medical school?
I went to Mayo Medical School at the Mayo Clinic in Rochester, Minnesota.
What is the scope of treatments you offer?
As a neurosurgeon, I've treated problems with the brain, spine, and peripheral nerves. The most common problems we treat are with spine because it's much more common than brain problems. And the typical things we see are disc herniations or spinal stenosis or degenerative diseases with the neck and back.
Why did you decide to go into neurosurgery?
Well, ever since I was young, we didn't have anyone in my family that was in medicine, but my mom would always say, oh, when you grow up, you should be a doctor. And so as I got closer to the time where you start to make those decisions, I started to look at it more seriously. And actually, I like the idea of being able to help people.
What's the one thing you tell people to get them to improve their health?
From the standpoint of neurosurgery, the biggest thing we can do to try and prevent problems with the brain or spine would be preventing trauma and injuries. So using seatbelts when you drive or ride in a car, using helmets when you ride motorcycles or bicycles. That's the main area where we can do things to prevent problems with the brain and spine.
What was your first job?
My first job was a part-time job when I was in high school, kind of doing our own business, painting houses.
What's your favorite junk food?
Right now, my favorite junk food would be morning rolls from the Bread Peddler in downtown Olympia. It's probably my biggest sin. It's actually it's a pastry. It's bread, but it has vanilla bean flavoring, and I like them because I like their coffee. So I like to take the morning roll and the coffee together.
Which is harder, brain surgery or rocket science?
I would say rocket science must be much harder because I feel pretty comfortable with the brain surgery.
Is there a moment in practicing your specialty where you've been really inspired by something?
I can't pinpoint one moment that I'd say would be the proudest moment, but I can say my happiest moments are when patients come back after surgery and whatever problem they came with is no longer there, whether it's a leg pain, whether it's a weakness, and they're better and they're happy. And I think that's the thing that makes me the proudest about my job. Thank you for watching. If you have any other questions, don't hesitate to call us at the number below.